You know, we're all taught to spot the signs of a heart attack or a stroke, right? We know every single second counts. But what about another, less-known medical emergency that happens at the very base of your spine? It's called Cauda Equina Syndrome. And today, we're going to talk about what happens when this emergency is missed and why, in this case, time isn't just important, it is literally everything.
And we're not just talking about saving muscle or brain tissue here. For people with this condition, every tick of the clock is measured in the most fundamental parts of being human: dignity and the simple ability to move. The stakes honestly could not be higher.
So what is actually happening inside the body that creates such a massive crisis? To really get it, we need to take a quick look at the anatomy.
Okay, so your spinal cord, the main bundle of nerves, actually ends in the upper part of your lower back. But below that, a whole bundle of individual nerve roots continues down, and it kind of looks like a horse's tail, which is exactly where it gets its name. Cauda equina is Latin for horse's tail. Now, when those nerves get crushed by something like a huge herniated disc or a tumor, their blood supply gets choked off and they start to die.
And these nerves are absolutely crucial. This isn't just about back pain. Think of this bundle of nerves as the main communication highway for your entire lower body. It controls your ability to walk, to feel your legs, the sensation in your groin and buttocks, what doctors call the saddle area, and, your most private, essential functions, control of your bladder, your bowels, and your sexual function.
So when that communication highway gets a major blockage, a clock starts ticking, a really loud one. There's this very small window of opportunity to clear that blockage before the damage becomes permanent. It becomes a true race against time.
And the medical literature on this is crystal clear. Surgeons call this the golden window. Ideally, from the moment those key symptoms show up, surgery to decompress the nerves needs to happen within 24 to 48 hours. Every single hour you go past that window, the chance of a good neurological recovery starts to drop.
A patient's entire future often comes down to one of two very different paths. The ideal response, what's considered the standard of care, is immediate action. You recognize the symptoms, you order an urgent MRI, you get a surgeon on the phone right away. But what we see happen way too often is a dangerous delay. Symptoms get brushed off as just bad sciatica. An MRI gets pushed off until regular business hours. And that delay, that's the exact moment a treatable problem can turn into a preventable, lifelong disability.
So how in the world are you supposed to know the difference between just typical back pain and a true 5-alarm fire emergency? Well, there are very specific symptoms. We call them red flags that every healthcare provider is trained to look for. And these aren't suggestions. Their presence demands immediate, decisive action. All right, let's walk through them. Number 1, saddle anesthesia. That's numbness in the areas that would touch a horse's saddle. Number 2, bladder dysfunction. This can go both ways. Either you can't go at all, or the opposite, you're leaking and you can't even feel it. 3, bowel incontinence. 4, weakness or pain in both legs, which is different from typical sciatica that usually just hits one. And number 5, sudden sexual dysfunction. If you report any one of these, it requires an immediate workup, period.
And this is a really important moment to pause and think, especially if this story is starting to feel a little too familiar. When you or someone you love went for help, did they do a thorough neurological exam? Did they specifically ask you about or test you for these 5 critical signs?
Now, you might think these cases get missed because a doctor just doesn't know what Cauda Equina Syndrome is, but what the source material shows us is that it's often missed because of systemic shortcuts, situations where hospital logistics or efficiency get prioritized over a patient's safety.
This timeline shows what we call the weekend gap perfectly. Look at this. A patient shows up on a Friday night with all the red flag symptoms, but, well, it's the weekend. The MRI is delayed, the on-call staff takes hours and hours to respond. By the time a surgeon is finally brought in, almost 2 full days have gone by. The entire golden window, that one chance to prevent permanent, life-altering harm, was completely lost to administrative delays, not because the medicine was complicated.
And here's a really critical point about the standard of care. Ruling out this emergency isn't something you can do from across the room. It takes a hands-on physical exam. We're talking about a pinprick test on the skin in the saddle area, testing reflexes. So if a provider gave you a diagnosis without ever getting up to physically examine you for these specific neurological problems, they may have failed to meet the required standard of care.
And when that golden window slams shut, the consequences are they're devastating and they are permanent. The cost of a misdiagnosis isn't just physical, it's economic, it's emotional, and it lasts for the rest of your life.
First up, there's the constant, never-ending cost of medical supplies.
For so many people, this means a lifetime of needing catheters, incontinence supplies, and a whole list of medications just to manage the most basic bodily functions we all take for granted.
And it doesn't stop there. Your home, your sanctuary, has to completely change. To deal with the new mobility challenges, people often have to install ramps, tear out their bathrooms to put in roll-in showers, widen every doorway. These are all huge, expensive projects. The impact on someone's career? It can be absolutely catastrophic. A lot of victims are in their prime working years, but now they can't do jobs that require standing, or lifting, or even just sitting for long periods. This just leads to a devastating loss of income and any sense of financial security.
And on top of all that, there's the therapy. A lot of therapy. We're talking specialized pelvic floor physical therapy to manage incontinence, vocational rehab to try and figure out new ways to work, and psychological counseling to even begin to cope with the trauma of a sudden and preventable disability. And that brings us to one last really crucial question. For so many people who have lived through this, there was a moment in that ER, in that doctor's office, where their gut was screaming that something was seriously wrong, even when they were being told it was nothing. So if your intuition was telling you that then, it's worth asking, what is that same intuition telling you now?